Let's talk about something most seniors and their families rarely question: medical checkups. Because while some tests can save lives, others might actually cause more harm than good. Today we're counting down 4 medical tests seniors over 70 should think twice about. And trust me, number 1 will surprise you. Number 4, brain MRI for memory loss. When older adults start feeling forgetful or confused, fear often takes over. Fear of dementia, fear of Alzheimer's, and naturally the first reaction, let's do a brain MRI, but here's the uncomfortable truth. MRIs rarely give the answers patients hope for. They're detailed scans that show the brain structure, but in people over 70, most MRIs only show normal age-related changes, slight shrinkage or harmless white matter spots, completely normal findings. The real problem starts after the MRI. Once these spots are seen, they can trigger a wave of panic, more tests, even unnecessary surgery, and all of it for nothing. In 2021, Neurology Today reviewed over 3,000 MRI scans of seniors with mild memory issues. The result? 86% showed abnormalities, but only 3% were linked to an actual treatable condition. That means 97% went through emotional stress, when nothing was truly wrong. And it gets worse. Around 12% were sent for invasive procedures like spinal taps or biopsies, based purely on vague scan results. Take George, a 74-year-old retired engineer. He felt more forgetful lately, misplacing keys, forgetting names, and nothing unusual. His doctor ordered an MRI which showed white matter changes. George panicked, convinced he had dementia. He stopped driving, stopped socializing, until cognitive testing later proved his memory was completely normal. After focusing on sleep, hydration, and mental exercises, his memory stabilized within months. The takeaway? Unless there are serious symptoms, like seizures, rapid decline, or sudden personality changes, an MRI isn't usually helpful for mild memory loss. A simple cognitive screening test is often a better first step, quick, affordable, and accurate without the unnecessary fear. Number 3, the cardiac stress test. Next up, one of the most overused tests in older adults, the cardiac stress test. Doctors often prescribe it for seniors who feel tired, dizzy, or not like themselves. But here's the catch. After 70, stress tests are far less reliable. They're designed to detect blocked arteries, but they can produce false positives nearly 40% of the time. That means the test says there's a problem when there really isn't. And once that happens, a chain reaction begins. Angiograms, stents, or even bypass surgery, all carrying major risks. A 2017 JAMA cardiology study found that over half of stents placed after stress tests offered no benefit in survival or quality of life. Instead, patients faced bleeding, kidney injury from contrast dyes, and long hospital stays. Like Raymond, a 75-year-old retired postman. He walked daily but mentioned mild fatigue going uphill. His doctor ordered a stress test, unclear results. That led to a catheterization and an unnecessary stent. The next day he developed kidney problems and spent nearly a week in the hospital, all for a false alarm. If you're over 70 and not having clear cardiac symptoms like chest pain, shortness of breath, or sharp drops in stamina, skip the stress test. A resting EKG or coronary calcium scan is safer, simpler, and far less risky. Number 2, colonoscopy. Here's one most people don't expect. Colonoscopy, the gold standard for colon cancer screening, can become risky after age 70, and is almost never recommended after 75 unless you have symptoms. The prep alone can be brutal. Strong laxatives that cause dehydration and kidney strain. Then there's sedation, which can impact brain function in older adults. And the procedure itself carries risks like bleeding, tearing, or even heart rhythm problems. A 2019 JAMA internal medicine study followed over 1.3 million seniors on Medicare. For every 1,000 colonoscopies in patients over 75, only 2 lives were saved, while more than 20 people faced serious complications. That's a 10-to-1 risk ratio. Dana, a 73-year-old bakery owner, learned that the hard way. She had no symptoms, no family history, and yet agreed to a routine colonoscopy. A small polyp was removed, but later that night her bowel was perforated. She spent 9 days in the hospital and never fully recovered. The U.S. Preventive Services Task Force recommends stopping routine colonoscopies after 75. For healthy seniors, a FIT stool test is a much safer alternative. Done at home, no sedation, and still highly accurate. Number 1. Annual full-body CT scans now. Let's talk about the most dangerous and overhyped test, the full-body CT scan. These are marketed as early cancer detection tools, often sold as part of luxury checkup packages. But here's the shocking truth. There's zero evidence that full-body CT scans save lives. Instead, they expose you to massive radiation, 10 to 20 millisieverts, or the equivalent of 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, up to 5% of all cancers in the U.S. may now be linked to unnecessary CT scan exposure. That's right, the very scans meant to prevent disease could cause it. They often detect harmless spots, small nodules or cysts, that come with aging. But once found, doctors must investigate. That leads to more scans, more biopsies, more fear. Marcus, an 80-year-old martial arts instructor, was one of those patients. His full-body scan showed a harmless 3-millimeter lung nodule. He was sent for a PET scan, then a biopsy, which collapsed part of his lung. The result, benign, but he spent 2 months recovering from something that never needed treatment. Experts agree. Full-body CT scans should never be used for general screening in healthy adults. If you have specific symptoms, unexplained weight loss, chronic cough, or swelling, targeted scans make sense. But scanning your whole body just in case is like searching for treasure with a landmine detector. You might find something, but the damage could be worse. Modern medicine is powerful, but it's not perfect. Sometimes less really is more. So before saying yes to any test, always ask, what happens next if this test finds something? What are the real risks versus rewards? And will the results actually change my treatment? Real prevention doesn't come from fear. It comes from lifestyle. Stay active, eat well, sleep deeply, and most importantly, choose your checkups wisely. Have you or a loved one ever gone through an unnecessary medical test or treatment? Share your story in the comments. We'd love to hear your experience. Thanks for watching, and remember, your health isn't just about more tests, it's about smarter choices.